My name is Melissa,
My name is Megan.
and we're going to be talking about the aging effects on the swallow. Presbyphagia refers to the alteration in the swallowing mechanism of an otherwise healthy older adult. The ability to swallow is vital to human survival. The swallowing dysfunction is common in the aging individual. Prevalence of dysphagia in the independently living elderly has been reported to be as high as 33%, and it's much higher in the hospitalized elderly and the institutionalized elderly. Those ranges are anywhere between 29 to 51%. The high prevalence is due to the joint effects of aging on the swallowing anatomy and the physiology, along with the impact of various diseases that could affect the swallow, such as neurodegenerative disease, dementia, and/or stroke. Um, these are very common and frequent in the aging population. Anatomical changes associated with the aging contribute to the presbyphagia. Those include reduced muscle strength and mass, oral dryness, diminished oral pharyngeal sensation, and the oral pharyngeal bone and joint deterioration. Research has consistently demonstrated that swallowing in healthy older individuals is slower, weaker, and less coordinated than in their healthy younger counterparts.
So, as we age, all phases of the swallow are affected. Respiratory support is also affected. Sensory changes impacting aging also may involve taste, smell, and tactile sensation and temperature. So, the effects of the aging swallow are four phases that are affected, and that's the oral phase, the oral pharyngeal phase, the pharyngeal phase, and the esophageal phase. So in the oral phase, there's slower oral transit, there's reduced bolus propulsive force and associated oral pharyngeal residue, piecemeal deglutition, so that's little bites of food at a time, premature spillage, and diminished tongue strength. So in the oral pharyngeal phase, there's only one thing, which is the slower transit time. And in the pharyngeal phase, reduced tongue driving force and pharyngeal contractions, reduced pharyngeal muscle thickness, slower pharyngeal transit time, and reduced laryngeal and hyoid elevation. So in the esophageal phase, a delayed and reduced extent of the UES relaxation. So that's the upper sphincter. And also reduced duration of the UES opening, which creates resistance to the bolus. So increased tendency for autoimmune gastrointestinal dysmotility and inadequate esophageal clearance. So there are some strategies to help people affected by the aging swallow. So the use of compensatory swallowing behavior, such as chin tucks, effortful swallow, the Mendelssohn maneuver, the supraglottic and supraglottic swallow can prevent aspiration or choking. Pacing and feeding strategies are also strategies that can be taught, and so that's for example, larger or bigger bolus sizes or smaller bolus sizes, and that can aid the faster pharyngeal swallow responses. So we reviewed an article that supported external and visual aids while eating, and it helps people remind them to take smaller bites and take a drink after eating.
And then, so what those include is if you have an elderly individual or patient that can't read, instead of using a card that says drink after bite or something like that, you could show a picture, and that way they would be able to benefit from those visual aids.
So there are muscle strengthening exercises such as laryngeal elevation, a tongue hold, shaker exercises that can keep muscles active and prevent muscle weakness or fatigue. So there's also sensory techniques that can help stimulate your mouth or oral pharynx, such as you can use a swab and you could put it in the freezer, or there's some iced lemon swabs that you can use, so they just stimulate your mouth. And worst comes to worst, there are prescription drugs out there that can help an aging swallow.